Hi, everyone. Welcome to All Things Breastfeeding, the podcast about concerning breastfeeding around the world. I am Barbara Robertson. I am your podcast host, and I am joined today by my LactaLearning co-founder, Nancy Morbacher. So, hello, Nancy.
Hi, Barbara. Good to see you.
Good to see you. Well, we are always, and especially you, checking out new research, what's coming out. And there was an article and then a commentary that were really released recently that we're going to talk about.
Mhm.
So we're going to be talking about tongue tie today, and that can be very controversial. And so, feel free to send us an email if you feel strongly enough about it. But we do know that tongue tie releases have been skyrocketing over the past 20, 25 years. And so, Nancy, this is concerning because it's 1,000%, some places even higher, 2,000% increase. And whenever we have something that is that big of a change in such a short period of time, we want to look at it closely. Tongue tie is a relatively safe, surgery, but it is a surgery. And we're doing it to very young babies. So we want to be really careful about what we're thinking. And so one of the things that you found last year in your travels was what was going on in New Zealand. So
Right.
talk a little bit about what they're concerned about there and what they're trying to do about it.
Yeah, well, I was aware of this before I went there, but I did talk to some of the clinicians there about it. In New Zealand, they were treating tongue tie, doing tongue tie release on like a larger percentage of babies than you normally see. It got up to 11%.
Mm,
New Zealand's a relatively small country, about 4 million people. And when they got to this point, they realized how many babies were actually getting these, surgical procedures. They started to think about it and wonder if there was a way that they could look at this more closely to make sure that was always being done, in the appropriate circumstances. And so,
exactly. Yeah.
yeah, so they started looking at it because I think sometimes what happens is that a clinician might look in a baby's mouth and see a potential tongue tie, and so they assume that whatever the problem is, is caused by that, which is
Hmm.
not always the case because we know from studies that 50% of babies who are identified with tongue tie actually don't have breastfeeding problems. And so
Hmm.
it can happen sometimes that you go to that as sort of a first step when you
Hmm.
see it rather than working on the basics. And so they decided to really focus on making sure they were focusing on basic breastfeeding dynamics and also, of course, ruling out any other conditions that might potentially cause the same problem that you might see with tongue tie.
Hmm.
One example of that might be something like torticollis, which is
Right.
when a baby is born with, muscles, pulled from their position in utero, and it makes it difficult for them to turn their head. It might affect their jaw shape and their ability to nurse.
Right.
So there might be other causes for some of the same symptoms that you sometimes see in babies with tongue tie.
Another example could be a birth injury of some sort,
Right.
or just weird shaping that needs to kind of
Mhm.
sort itself out,
Right.
from the birth. And so, yeah, so they were concerned and they have basically trying to move to a more conservative approach
Right, right. And
for releases.
they have successfully brought down
Mhm.
the percentage of babies. Of course, it's always a delicate balance because there are some babies who truly do benefit from
Yes.
going through a tongue tie release. And
Hmm.
you want to make sure that those babies who really need it receive it. And so that's really their focus.
Okay. Well, there was a brand new article that just came out January 2026,
Mhm.
and it's Endoglossia, breastfeeding and infant weight gain,
Right.
a mixed method study. And we'll have a link to that study in our show notes on LactaLearning's website under podcasts. And so the author is, you said it better than I did,
Rowell,
Raoul
Raol.
RAOL 2026, and it was in Pediatrics. So if
Correct.
you're looking for the article, that's where you can find it.
Mhm.
And this article was fascinating. And so talk a little bit about what Raoul and his colleagues did.
Well, what they did is they in the area they're in India, and
Mhm.
in the area that they were studying, they went to a large hospital, and tongue tie releases are not performed there. It's
Mhm.
It's not something that they do. And I find that as I travel around the world, there's some things that you do in some places and not in other places. And this
Right.
is an example. And so
Mhm.
they decided this would be interesting to follow 476, I believe it was, mother baby pairs. They identified babies 48 within 48 hours of birth, and they followed them for the entire first 6 months. And
Mhm.
so this is the first study that has really looked at the trajectory of how breastfeeding goes during the first 6 months in babies who are identified as having tongue tie, but do not have any sort of corrective procedure done.
Right. And another thing that was interesting about this article was the setting and the
Mhm.
breastfeeding culture. So talk
Right.
about that.
So this is a part of the world where breastfeeding is the cultural norm. And so when mothers went home, they had lots of support through primarily through female family members. And
Hmm.
so at the end of the 6 month period, you had about 80% exclusive breastfeeding rates.
Wow.
In like some of the study babies were identified as not tongue-tied and some were identified as tongue-tied, but both of the study babies, was somewhere between like around 75 and 80%. So that's something that's really different
Hmm.
compared, because here in the US, we have a exclusive breastfeeding rate of about 27% right
Right.
now.
Once we get to that 6 month marker.
Right, right.
Well, and what was really interesting about this is they did not find big differences
Mhm.
between the babies who had been identified with a possible tie
Right,
and the babies who were not. The
right.
breastfeeding rates at 6 months ended up being about the same.
Right. And what the authors mentioned is we have so many studies on tongue tie. I mean, we have a glut of them,
Oh, yeah,
but
we do.
but what we don't have are groups that compare what happened if you do the tongue tie release procedure and you don't. And
Hmm.
so, for example, how many of the babies who did better after the release would have done better
Better
anyway
anyway.
with maturity and growth? We have no
Right.
idea of that.
Yeah. Yeah. And we do know that many, many breastfeeding problems resolve themselves with time. And
Correct.
so if we are doing these procedures within the first few days or first few weeks, we don't know what time would have done to help.
Right, right. So that's what makes this particular study unique.
Well, we were not the only ones who thought it was interesting. Witt and Furman,
Mhm.
yeah, they actually were so I think pleased is the word. They were happy with the study that they wanted to comment on it, and
Right.
it's in the same edition of Pediatrics. And so
Yeah. So
yeah,
Ann Witt and Lydia Furman, are both breastfeeding medicine doctors, and I've been following their research over
right.
the years. So I was really pleased to see who it was who was making the commentary because I know that these are both very breastfeeding friendly doctors.
Hmm. And the article was called Untreated Ankylosing, a Broader Perspective.
Mhm.
And so again, we'll have a link to that article. And so what did they comment on? What did they like?
Well, so one of the things that they really liked was the fact that this was done over time in a culture where breastfeeding is the norm. And that's not something we can say about any study that's done here in the US for sure.
Right.
So that was something that they really appreciated about it. But they had other comments that, where they felt that the study could have been improved.
Sure. I mean, it's hard though. We're working with babies and many families have strong feelings about how babies are treated.
Right.
So, it's hard to do good studies on babies. So what were some of the concerns? What would they have liked to have seen?
Well, the tool that was used to evaluate for tongue tie is
Mm,
called the Bristol Tongue Assessment Tool. It was
right.
developed in the UK, and it's a
Hmm.
very simple one. It just has
Very.
a one number score.
Hmm.
You can score a baby anywhere between 0 and 8. And
Hmm.
so they consider a score of 0 to 3 to be a really severe restriction of tongue movements.
Hmm.
They consider up through 5 to indicate this is probably a baby who's likely going to get a tongue tie release. But
Hmm.
what these researchers did is they considered only those babies who scored an 8 to be not tongue tied, and
Okay.
any baby who has 7 or below to be in the tongue tie group. And so many of the babies that they considered tongue tied,
Hmm.
we might say, well, if at best it's a very mild tongue tie.
Hmm.
So only 33, like in the tongue tie group, there were 110 babies in the group that they considered tongue tied, but only 33 of them were at this score of 5 or less, and only 2 of them scored 3 or less.
Hmm.
So it was 7% of the total study babies who were 5 or less.
Yeah. So it would be interesting to identify babies who scored higher, that were more, or lower actually,
Right,
that were
right,
more severely restricted
right,
through either function or appearance. And they just look at appearance, if I
right,
recall
correct,
correctly. They don't
correct.
have function, unlike some of the others. And again, we'll have a link to the Bristol. Also, I personally like the Martinelli scoring system, which
Right.
has function and appearance.
Well, they picked this one because it was simple,
Right,
essentially.
right. And it's easy, right, to document. It's because
Right.
honestly, so a lot of it is subjective. You
Mhm.
know, when you're looking at something, it's like, okay, is there peristaltic motion? Is there not? You
Mhm.
know, what are people's interpretations of that? And so,
Yeah.
I think that, yeah, it's easier to go simple.
And Witt and Furman pointed out that really none of the tools that we use are as
No,
well validated as they would prefer.
absolutely. Yeah.
So there is that, but yeah. But what
Well,
I think one of the things that they noted about the study that was really fascinating, I think, is really there was no difference in weight gain at all during the
mm,
entire 6 months between these two groups.
hmm.
And what they did, this was a mixed method study because they actually did semi-structured interviews with a group of the mothers from both of the groups and to
Hmm.
find out why did they stop breastfeeding, because some of them did stop breastfeeding, but the rate at which they stopped breastfeeding was the same in both groups.
Hmm.
And it was really unrelated to what we might think of in terms of tongue tie. And in fact, it was perceived insufficient milk, which was the same in both groups. And we know that's the number one reason that all mothers all over the world stop breastfeeding.
Right. We have some good studies that show us that it's throughout the whole first year, worries, concerns, not actual low milk supply, but concerns that you might have it is the number one reason for weaning.
Right.
Well, one of the major problems with this whole tongue tie releasing is that it has become a big business.
Hmm.
There was the New York Times article, Inside the Booming Business of Cutting Babies' Tongues, which was not my favorite article, by the way. But they
Hmm.
do bring up the point that there are some pediatric dentists, some family practice doctors, that are releasing many, many babies every day. It's
Hmm.
just a huge part of their practice. And another thing that concerns me is the rising cost of this. When I first started working, you could get a tongue released for about $350.
Hmm.
Now it's mostly over 1,000, sometimes 2,000.
Hmm.
And so it makes it inaccessible to some families, the cost of it. And also it is an opportunity for practitioners to make a lot of money. And, we're not calling out any particular practitioners. It's just when we know human nature says that if there is benefit involved to you, you are more likely to engage in the behavior. And
Hmm.
it's confirmation bias, right? If you're looking for zebras all the time, you're going to find the zebras.
Hmm.
So what do you think about money and how this might interplay with all of this?
Well, I think one of the issues, of course, is when you have low income families
Yeah.
and there's a baby who really needs to get a tongue tie release, then, it may not be affordable for many families.
Yeah, and that has absolutely been the case in my world. Well, let's talk about what the research says the prevalence of tongue tie is. And so, when we think about the prevalence of tongue tie, Witt and Furman, they have a number that they use. And so, yeah, I think you said it was sorry, I wrote it down,
2.8 to
2.8 to 10.7.
right. And that's, I think, the number we use in breastfeeding answers as well.
Yeah, and so, it's definitely many babies have this.
Hmm.
And so we do, again, we're not saying don't cut, don't release frenulums.
Right.
we're saying, ugh, maybe we're releasing too many.
Well, and Wit and Furman say exactly the same thing. They say specifically straight out, we're not saying that babies should
Yes.
not receive the frenotomies, that some
Hmm.
babies really do need it. So
Right.
it's a matter of striking the right balance.
Well, and the Academy of Breastfeeding Medicine's position paper says exactly the same thing.
Mhm.
They do say that we're doing it too much, but we
Right,
have to keep doing it for the babies who really need it.
right.
And in our world, it's tricky. So let's talk about a scope of practice. You and I are both IBCLCs.
Mhm.
And so, what is our scope of practice regarding tongue ties and tongue releases?
Well, we cannot diagnose and
No.
we cannot release them
Mhm.
unless we have other credentials that make
Right.
that possible.
Yeah.
So what that means is we might be able to identify them and suggest that the appropriate healthcare provider diagnose and or treat.
Right. In my reports, I use possible oral restriction.
Right,
And I, document as to why. Why
right.
do I think that? But yeah, we can't diagnose. And I think that was one of the things inside the booming business of cutting babies' tongues. Many of us IBCLCs, we see this so much that we're like, oh, the baby is a tongue tie. And it's
Yeah,
like, hang on, hang on. We can't say that.
yeah. And
Yeah,
I think
so we
it's
have to be
interesting.
careful.
One of the other dynamics in the Rowell study was that the mothers were never told that their babies were in these groups. So in other words,
Mm.
no mother was it ever suggested to that her baby might have a tongue tie or that this might impact breastfeeding. And I wonder if that might not have been one of the dynamics at work here too.
Right, because that could plant a seed
It
that
could,
something is wrong.
right?
Yeah. And again, so if we have IBCLCs or other lactation supporters or anybody who's like, oh, I think that baby has a tongue tie, that's like
Yeah,
and people are going to be more wary and
right.
suspicious.
They may believe that nothing's going to help breastfeeding get any better until they have the tongue tie addressed.
Right. Right. And you always say that in the United States, we treat breastfeeding as an accident waiting to happen versus what is biologically designed to work incredibly well. So if we already have that attitude, that's not going to help us. All right. Well, and but on the other hand, too, I know as an IBCLC in private practice, I would say a higher proportion of my babies did have a possible oral restriction.
Right.
And why is that, Nancy?
That's because we're seeing people with problems. If we were
Oh,
seeing
right,
the
right,
general
right.
population, it would be very different.
Yeah. So we're not seeing all the horses.
Right.
We already have a higher percentage of zebras mixed in the mix.
Yes.
Yeah. Okay. Well, and again, so this is just again food for thought. I think that I made a decision when tongue ties were really exploding that I had to be wary of confirmation bias myself. And I
Mhm.
had to make sure I was doing my best lactation support. Because, first of all, even if there is a tongue tie, a possible oral restriction, families may choose not to have it released. And therefore, there's a
Yes.
lot of tools in my toolbox
Right.
that I can still use. And I think that that is what concerns me the most is that people are like, oh, it's a tongue tie,
Right.
go get it released rather than, oh, it's a possible oral restriction. Let's make sure latching and positioning is optimal.
Right.
Let's make sure milk removal is optimal. Let's make sure, all those foundational skills that we have as lactation supporters. Because I think it is really like to pass it off. It's like, oh, well, this is tongue tie, goodbye.
And as I mentioned at the beginning, we do have research to show that only about half the babies who are identified as having tongue tie actually have breastfeeding problems
Right,
that
right.
are related to the tongue tie.
And so it is this balance, and I think balance is the word here.
Mhm.
If we have a baby who is struggling with weight gain, if we have a parent who's really in pain, and we have a possible oral restriction, that baby should move higher up the list of like possibly. But we also need to, again, be doing our best practice care and making sure that that's going well. Well, this again was so interested. I think it's, the pendulum has, well, it was over here. You couldn't get a tongue released, 30 years ago. It was really hard. And now it's like everybody's getting their tongues released. So we're finding that balance point, because as Nancy said, as Ann Witt and Lydia Furman say, some babies absolutely will benefit tremendously
Mhm.
from a frenulum release. Um, so we want to make sure those babies are being treated and being cared for. But if it's an unnecessary surgery, can we avoid it?
Yeah, exactly.
All right. Well, Nancy, thank you so much for bringing these articles to my attention and coming and joining us on All Things Breastfeeding to discuss them. We always appreciate your wisdom.
You're welcome. Thanks for having me.
If you are enjoying All Things Breastfeeding, we would encourage you to leave us a review, and that could be on your favorite podcast listening device, or if you're watching this on YouTube, go ahead and leave us a positive YouTube review. We very much appreciate it, and thanks for listening to All Things Breastfeeding.